Hello, today I am going to tell you something briefly about breast cancer surgery and its types of reconstruction. Most of us know that following breast cancer surgery, the lady has a lot of psychological problem due to the reduction of the size or the loss of the breast. Today we are going to talk about these issues and how to address these problems. I am Dr. P S Bandari, Senior Surgical Oncologist at Apollo Cancer Hospital and a breast oncoplastic surgeon. Breast cancer surgery started 100 years back. At that time, the entire breast and the front portion of the chest used to be removed, leading to lot of problems in the post-operative period. We no longer do this surgery. The recent trends are a modified version of radical mastectomy, which is known as modified radical mastectomy, is done. It is less disfiguring than the original mastectomy, but still it is also associated with lot of problems for the person undergoing surgery. Like again, the chest wall becomes flat, there is complete loss of breast, there is a ugly looking scar, and in addition to that, shoulder stiffness and swelling of the arm can occur. So in order to avoid these problems, the recent advances in breast cancer surgery are what we do is known as breast conserving surgery, wherein we remove that entire tumor which is present in the breast without compromising complete tumor clearance. That is one thing. And at the same time, we will do the modified reconstruction of the breast so that the shape of the breast is not altered. However, even after doing local reconstruction of the breast, still there is some kind of depression and asymmetry with the opposite breast. It does not resemble the opposite breast. So in order to avoid this and to bring about symmetry of the breast compared to the opposite breast, we do certain procedures which are known as Oncoplastic Reconstructions. So what is this Oncoplastic Reconstruction? Now once we have removed the tumor from the breast, there is a large defect lying in the breast in the form of a cavity. So we have to fill this cavity. So what we do is we use the patient's own breast tissue from the other parts of the breast and fill this cavity. This is known as Oncoplastic Reconstruction of the breast using the patient's own tissues. The other variation of this is when the defect is larger than 50% of the breast is lost due to removal of the tumor. In those cases, we use tissue from adjacent parts of the breast tissue and cover this defect so that the entire defect is covered by the normal tissues from other parts of the body and the original shape of the breast is restored compared to the opposite breast. Sometimes in some patients where some low grade tumors are there but they are occupying, the entire breast is occupied in multiple areas. In those cases what we do is, saving the skin and the nipple areola complex, we remove that entire breast tissue, and once we have removed that entire breast tissue, to give shape to the residual portion of the breast, we put an implant. This is known as skin sparing mastectomy with implant reconstruction, so that the original shape of the breast is restored. Sometimes when the defect of the breast tissue lost is quite large, in those cases we have to bring some tissues from other parts of the body which are not near the breast, and this tissue is known as flap reconstruction. From the back of the chest or from the abdomen part, we bring the fold of tissue which is containing skin, fat and muscle, and it is a live tissue. It's a live donor from that area of the patient which is known as autologous replacement. We use the patient's own tissue and implant it in the area of the breast which has been lost due to surgery. So this is also a form of reconstruction known as reconstruction with flap, autologous flap reconstruction. Another recent advance in breast cancer surgery is the use of Sentinel lymph node. As you already know in your experience, where a lot of women, they tend to avoid breast cancer surgery because they have fear that following surgery their arms will swell up, what we call in scientific terms as lymphedema. In order to avoid this, there is a recent technique which is known as Sentinel lymph node biopsy. Using a special blue dye and technetium dye, we identify the nodes which are likely to be involved by the cancer, remove those nodes and check them in pathology while the patient is on the operation table. If the nodes are negative, then there is no need of removing all the nodes. This technique of Sentinel lymph node biopsy avoids unnecessary axillary dissection, hence avoiding lymphedema of the arm or swelling of the arm. This has led to great relief to women undergoing breast cancer surgery. Thank you.